There's a secret agent in a dentist's arsenal that can solve many cases of teeth trouble. The agent's name? Bond, dental bond. Dentist Steve Marsh is here to introduce us to this agent's assets and how it can overcome crimes against your smile.
Oh, that was a wonderful opening. Thanks, Lori.
Yeah, we had to go there, you know that.
Sure.
So we're talking about bonding, tooth bonding. So what exactly is that?
So bonding can be used in a number of ways. Bonding is a way we can add material to a tooth, whether it's a hole in a tooth from a cavity, for example, or we're adding some to a corner, for example, that's cracked. Or we can use bonding to cover a discoloration or a seam in the tooth. So it can be, that term bonding can be used for a number of things.
Okay, but isn't that kind of old school? I thought veneers were the go-to method these days.
Okay, so wonderful question. Veneers are a go-to method if we're wanting to really cover the entire surface of the tooth, where if it's a front tooth that's discolored or you have numerous ones that are fractured or misshapen, that's where a porcelain veneer can be done. But when you just add a corner and you want to do something in a more modest way, bonding's the way to go. It's less of an investment for the patient. It can be done at one appointment.
And it's changed over the years, I'm assuming, too.
Yeah, it's really changed, and I brought some examples.
Okay,
if you
yeah, so show
Here's
us.
one of the ways it's changed. We now have these bleaching shades. You know, everybody has whiter teeth, so some of the bonding materials that we had years ago don't match up. So now they've invented composites that are better. They're smoother, they're stronger. And Lori, if I can, I'm going to just show you how I do it now. So let's say you had a hole in the tooth. We actually extrude it with this gun, if you will. And it goes on, and it's fairly soft when it goes on, and we use a bonding light, and I'll try and do it quickly. And that actually hardens the material. Mm-hmm. And at this point, it's nice and strong.
Oh, okay.
So it can be done in a relatively short amount of time to augment or to change a color or shade.
But you're adding this kind of material to the tooth that doesn't make it feel thicker or different in any way?
No, in the same way if you have a dent in your car, they can Bondo it in and then they paint it and you can't, it's seamless. That's how bonding should happen in dentistry today.
Okay, and with the colors and that smooth material, man, probably is great. But you've got some pictures, right, to show us how it actually works.
Well, I thought it would be a good example to show you in a very modest way how we've taken care of patients. So this is a young woman. She's a physician, and you know, Lori, it's interesting. Today, many of the dentists and physicians are women, and she came to me. She's actually new to Cleveland, and you can see that her front two teeth look good. She had braces. The lower teeth, I did a little reshaping to get them straighter. But what you also notice is the laterals, the two teeth on either side of the middle ones, were lacking in dimension. They were twisted a little bit. And because everything looked so wonderful, and she's a busy physician, we thought, what can we do? And we just did some whitening, bleaching first, and then some bonding to augment those. And you can see it's pretty perfect and very strong.
Yes.
This young woman was in her sister's wedding. She came to me a few weeks before. I actually had to do veneers, or got to do veneers on the father and mom, because they wanted to have perfect wedding pictures. She didn't have the time. She's a professor, and so we did some lower reshaping. But we used bonding on those four front teeth to give her the dimension she had. She had chipped the teeth, and again, those laterals are oftentimes shorter, and we were able to bond with those. So this is an interesting thing. She's not we don't just do it on young women. This is a woman here in her 80s. She's a Golden Opportunities fan. We reshaped the bottom, and I said, you know, we can change that space. She brought a picture of herself when she was young and had a small space, now a big one. We wanted to show her what it would look like. We did bonding, and then later came back with some porcelain veneers to give her a little more strength. And lastly, a young girl who had had discoloration. A different dentist went in and tried to cover it with bonding. Now this is a case where sometimes you have to go to veneers. We did some gum shaping, went on to porcelain veneers on the front, and did some bonding in the back. So sometimes you use a combination of both bonding and veneers to get the desired result.
All right, they looked great. There's no need to keep your smile undercover, thanks to the not-so-secret agent of bonding. You want to plot your own escape from troubled teeth? Give Steve a call. His number's no secret, and it's up next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com.